The NHS is in crisis, from GPs to hospitals, ambulances to long-term care. The system is buckling. A service established nearly 75 years ago to serve the public from cradle to grave is itself in need of urgent care. Tonight we ask, can the NHS survive?
Every bed in every bay is full.
Patients waiting several hours in ambulances and hospital corridors.
Never, ever seen anything like this before.
The NHS is under huge pressure.
Have declared a critical incident.
They don't deserve to be treated like this.
Patients should be able to rely on a basic level of care.
There's not a minimum level of service any day because they've broken the NHS.
Looking increasingly difficult to heal.
They can't just keep letting this happen.
Welcome to University Hospital, Coventry and Warwickshire, with over 1,000 beds, a busy emergency department and much else besides. And also the place where the world's first COVID vaccine was given to a member of the public in December 2020. The nurse here tonight who did that. Well, since the pandemic, resources here and across the NHS have been stretched like never before. A&E departments are described as war zones, staff are striking, public confidence is plummeting, and politicians can't agree what to do about it. So today, Sky News is launching a year-long project with analysis from two of the UK's leading health think tanks, the King's Fund and the Health Foundation, to find solutions to the crisis gripping the NHS. Well, think of the health service as a sick patient, if you like. We'll examine the NHS itself, diagnose what's wrong, and at the end of the year, come up with a treatment plan designed to breathe new life into an ailing system. Tonight, then, the first full assessment. Well, joining me are Sky's economics and data editor, Ed Conway, our political editor, Beth Rigby, and Hugh Alderwick from the Health Foundation. And in the audience to give us their experience from inside the NHS, staff from the hospital and the wider healthcare system here in Coventry. And an audience of around 200 Sky News viewers, all with their own experiences of the health service. Welcome to all of you. Well, before we go any further, I'd just like to find out how many of you have had recent experience of the NHS yourselves, say after the pandemic. Put your hands up if you have. And keep your hands up if for you that was a positive experience. So up for positive. OK, so perhaps half of you went down. It's certainly a good starting point. Well, the first port of call for many sick patients is, of course, the GP. So let's bring in one of our audience members who is a GP himself, Dr. Simon Taylor. If you put your hand up, we can see you. Thank you. Hello. Thanks for joining us, certainly. Oh, it's the gateway, isn't it, to the health service, the GP. I know you've been a doctor a military doctor. How does it compare right now? We heard the description there of it being like a war zone at the moment.
Well, I left the military in 2011. I did operational tours in Iraq, Afghanistan and Bosnia. And I would make the point that in certain situations it was easier for me to admit a seriously ill patient in a war zone than it is now. I would give the example a few weeks ago of where I did a home visit and I saw a patient, I won't go into details, who was clinically obviously developing signs of a stroke. So I assessed the patient, called 999 and was told it would take 10 hours to get the patient into hospital. So I had to make a very quick decision. I went back to my surgery, finished my afternoon clinic, then came back and took the patient in my own car to the nearest accident and emergency department. And frankly, I don't see how that is acceptable in 2023.
OK, well, let's put that point and some of the issues you raised there to our panel. Hugh Alderwick, I mean, the stories we're going to hear tonight, you know, paint a picture of crisis. But if we summed up what the problem is, you know, the capacity is too low, there's not enough staff, and there's too many people really stuck in hospital.
Well, so there's massive pressures right across the NHS. There's grim data on long waits for hospital, but the crisis is in general practice, in social care and mental health. It's everywhere. There's a mix of issues. Some are short-term. Clearly, the pandemic has had a big impact on the NHS, a lot of disruption. But really, the underlying causes of the problems are much longer-term, and they're down to political choices over the last decade. And they're about capacity, really. There's chronic staff shortages in the NHS, about 130,000 staff short, but also in adult social care, where staff shortages are even higher. There's a broader pattern of constrained resources. We went into the pandemic with fewer doctors, nurses, hospital beds, equipment per patient than many comparable countries. And we've had a decade of low spending growth, lower than the historic average, and also weak spending on capital, buildings, IT, equipment, the things the health system needs to be productive, things that staff need to do their job properly. And it's not just about the NHS, it's also about the broader health of the nation. The adult social care system has been scarred by a decade or more of political neglect. Wider public services are creaking. And so these problems interact. They have knock-on effects on each other, and they hold back the system and its ability to function. So it's a mix of problems, but it's not just about the pandemic, it's the long-run political choices that have been made.
And Ed, we know the NHS runs hot, doesn't it, if you put it that way? But capacity is straining in every area. And the easiest measure, I guess, is beds sometimes. And we know that in the last 30 years, the number of beds in the UK has halved.
It has. And I mean, I should say, if we take a step back, I mean, part of the reason that we're doing this at Sky News and the reason that we've given it so long, we're a journalistic organisation, we wouldn't normally conduct an investigation or indeed a project that takes quite as long as this one, is just because the scale, not just of the issues, but the scale of this organisation is so enormous. And to some extent, the NHS, well, it has been in crisis since its very first days. The earliest kind of crises were not long after the foundation of the NHS, and ever since then, it has been said to be in crisis, if you look back through newspaper cuttings. But even so, when you look at most of those metrics, and, I was putting together charts in advance of this show, and I actually kind of just kept adding more and more of them. Quite scary, just in terms of whether it's waiting times, whether it's looking at kind of hospital beds, whether it's comparisons with other countries around the world. Not entirely, it's not across the board. In some senses, there are many things we can be very proud of, but in other senses, there's lots of strain. And that comes back to the fact that when we're talking about, the health system as a whole, it's a lens on the country and many of the bigger issues we're facing, whether it's demographic, whether it's the fiscal issue right now, so how much money we have to spend on it, whether it's just where we are right now after the pandemic. And when you consider all of that, those are such enormous issues that there is no single answer, there's no single chart I can show you on this that's going to kind of tell that story. But right now, so many of those different metrics, when you look across the piece, are definitely very strained.
And we'll look into more of those as the programme continues. What about staffing? We've heard some of the shortages issues. If you were doing a situation report for government right now, Beth, there'd be red flags, wouldn't there?
There would be red flags all across the system as well, Anna. And when I report about this in my life as political editor, the two stats that really always stick out to me is the 7.2 million on waiting list, just the scale of demand and people's needs not being met. And then the Royal College of Emergency Medicine said recently that they estimated 300 to 500 people a week were dying because of backlogs and not getting seen quick enough, as you were talking about. And I should say the government and the NHS refute that figure, just to be clear. But in terms of all of that, what would you say about staffing? Well, the government would say that they've recruited nearly 25% more staff since 2010, 80,000 more nurses and doctors, but it just cannot keep up with the demands of an ageing population and more complicated health needs. Labour's point of view, they have put out what they would describe as their retail offer ahead of the general election, and that is their plan to abolish non-dom tax, which they would say would create 3.2 billion, which they would then use to double junior doctor places, more nurses and more health visitors, 30,000 more staff. But the obvious thing is, that could be, well, they might not win the election, and then that's the middle of the decade and the staff shortages are now. The other thing I would say about it is part of the problem is the tight labour market means that doctors and nurses and NHS staff that are fed up with below inflation pay rises and a decade of real-term pay cuts, they do have the option to go to other sectors. And actually, I had an email from a junior doctor today, actually, telling me about how, although they are training, retention and morale is at a rock bottom. People are looking to leave the health service at the very point that the government need them to stay.
I can see some of you with your hands up. I promise we will come to you. I just want to do one more thing before that, if that's OK. I can see people itching to get in straight away. We've talked about the gateway to the NHS being GPs. The other way, of course, that people come in is via ambulance. So I now want to talk to James Jackman, who tried to get in. James, if you put your hand up as well. Hello there. And it's been you want to talk? Sorry, yeah. I want to talk to James Jackman and, you know, the difficulties that you faced. There you are, sorry, yeah.
Oh, yeah. Yeah, I was told there would be a delay when I called for an ambulance for my partner. And that took nearly 11 hours, which is quite shocking.
And tell us about your wife, Hannah, then.
She wasn't very well on the evening. I was convinced more than she was that she wasn't very well. Otherwise, I would have, which I suggested taking her by a car, but she wasn't having none of it. Yeah, I called the ambulance for her, and she went into hospital. We had a delay getting from the ambulance into the hospital itself. And then as she progressively gotten worse, we had a delay to get her onto critical care. Yeah.
James, we know this is really difficult for you because it's so recent. It was December the 18th that you called the hospital, wasn't it? You called 999. You called at 7:20. They finally arrived at 6:15 in the morning. We know this is very difficult for you. We appreciate you sharing that story with us. I know it wasn't this area, but let me go to Andy Hardy, who's the chief executive here. You know, how common are stories like that of people either waiting at home for an ambulance or the ambulance is outside the hospital and they can't get in here?
Well, those stories have become far too common for anyone to say. I'm pleased to say often not such a sad end, we just heard that out there. There is pressure. There's pressure throughout the whole system, as we've already heard, and that often sort of magnified when these ambulances sitting outside hospitals who need to offload their patients because they're often waiting to get to another patient, and then we have certainly seen that. But we know that the challenges are multifactorial. Hospitals are full because they can't discharge patients. Do we have services outside of hospitals which actually could deal with some of the people who are coming into hospital who don't need to come into hospital? So we need to act as a system, not just hospitals on our own, working with ambulances, working with all other providers within the system, and social care. Social care has a really important role to play in this. And that's the way we can avoid such sad stories in the future.
We missed the first part of what you said. You were giving your sympathy, I know, to James and his family and to everybody who's been in that situation. And, you know, we'll wholeheartedly offer our condolences as well to you. Well, let's hear more about the pressures then on the ambulance and what they've been like from the people on the front line of the service who take those 999 calls. Our correspondent, Becky Johnson, is in the control centre for the West Midlands Ambulance Service in Derby. And Becky, I know that you've spent a lot of time with the ambulance service over the past week or so. You know, what's it been like and how is it now?
Well, this is the main hub where 999 ambulance calls come to in the West Midlands, and it's these call handlers that have to try to find those resources to send to those most critical calls, and it's been incredibly difficult this winter. Let me give you an idea of the kind of waits that people have experienced. The longest wait a West Midlands ambulance had outside a hospital, so they couldn't get into a full A&E. Last month, 32 hours, 57 minutes a patient was waiting in the back of an ambulance. Now, that means, of course, the ambulance can't then get back on the road to respond to other critical calls. This month, it's a slightly better picture. So the longest wait this month has been 11 hours, 57 minutes. And that's reflecting a national picture, actually, that things are easing slightly, but only slightly. Ambulance handover should be done within 15 minutes. I've been speaking to the guys here to find out why things are easing just that little bit. And there's a series of reasons. They say they're seeing fewer flu, COVID and strep A cases thankfully, but they've also put in place measures that help them to cope with these unprecedented pressures. So in some of the busiest A&E departments, we've now got advanced paramedics from the ambulance service working with healthcare assistants in new areas that have been set up to treat patients so that ambulances can drop the patient off and get back on the road, and they're in the care essentially of a paramedic within the hospital. There is also concern here that the call numbers aren't as much as they would be expecting at this time of year. And when I was out with crews a few days ago, we went to a call, an elderly man who'd fallen 2 days earlier. He had a serious arm injury, but his wife said she'd felt bad and delayed calling 999 because she said it wasn't a matter of life and death. Now that's where some of the messaging around strike days has led to people not calling, and also because of what people are hearing, because they're hearing that they could get stuck in an ambulance for hours on end, or they could get stuck in a corridor in a hospital, and therefore people may well be feeling scared to call 999 when they really do need help. So the message from the workers here are, please, obviously don't add to the pressures if you don't need them, but if you do need them, they are here to take your call.
Becky, thank you very much indeed. Well, Hugh, I mean, if you think of it like a pipeline, there's a blockage, the whole system backs up. That's kind of the impression we're getting.
Yeah, and it's not just one pipe, it's lots of interconnected pipes. James, I was really sorry to hear about your experience. Long ambulance waiting times is a good example of these blockages. So that's often the front door into a hospital, but if you think about the back door, hospitals are really struggling to discharge patients out into the community or home because there's a lack of services or support in the community. That means there's beds full of patients that don't necessarily need to be there, which means you've got a lot of beds full in hospital, high bed occupancy, which can be unsafe, which means you've got patients waiting in A&E to be admitted to a bed, and that's why you've got ambulances waiting. And a small pressure somewhere in that system can have a big knock-on effect somewhere else. So the sort of scary data we see on waiting times in hospitals just reflects the pressure we see right across the system in general practice, in social care and mental health, everywhere. And that means the solutions are not just about hospitals, they're about that wider system as well. And then if you stand back even further, the NHS is one bit of a bigger system of public services that keep us healthy, that later on dictate when we need health services, like local government services, public health. But parts of that system have been eroded over the last decade, which means the NHS is often left to pick up the pieces.
Well, ambulance wait times, one good example as a measure. The other has been excess deaths, which we've heard a lot about. And certainly, records are being broken, which is, just the worst thing to hear.
They have, and so long after the pandemic, and these numbers each week are deeply depressing. And let me show you, though, we've got a few charts that we can show you on ambulance wait times, because those numbers are incredibly stark at the moment. This is showing you the mean waiting time. So it's, obviously different people's experiences may vary for different categories. So from category 1 through to category 4, so deemed the most severe risk to life through to less severe risks. And this is look at those bars. That's how many minutes or indeed hours people were having to wait before the pandemic. So you might see that as being a kind of relatively decent kind of record here. But look at what's happened. So that's January 2020. Look at what's happened and where we are now. Look at these bars. So that's where we were just in the last, actually, it should say in December of last year. Look at how far those bars have gone up. You're talking about 4 hours wait on category 3. And these are averages. So, James's experience is unfortunately mirrored by those many people who are having to wait even longer than these average waiting times. And Andy was referring to that, that issue of the blockage and, how many people are in bed in hospital for long periods of time, partly because you can't get those pathways out of hospital. Well, these lines are just showing you the number of beds over given periods. So each of the different lines is a different year going back the last few years. That's what you might consider to be a normal level of bed occupancy, of long bed occupancy, over 7 days. And now I'm going to bring up this latest year that we're in at the moment. So look at that red line. It is just way out of whack with anything from previous recent history. And that is just, it's underlining the difficulty of clearing those beds so that people can actually occupy them. And the fact that it's at the end, it's the exit to hospital, and it's also entrance to hospital as well.
Well, Beth, the government has refused to call this a crisis and blamed a respiratory illness plus the problem of social care as well. They have so far not done a deal with those unions who are striking, physios today, as we heard. How would you characterise how they are handling this?
Well, in terms of how they're handling it, it is a standoff between health workers and the government. And I'm afraid to say, and I check in on it pretty much every day, it is stalemate and there is no movement. So we have a strike day of ambulance workers and nurses, the first day both together on February the 6th. And I'm afraid to say that when I check in with government, all of these strikes are still going to continue. The government's position has not changed, which is they will not discuss the current year pay deal. That's the year until April 2023. They will discuss the pay settlement for the year April 2023 to April 2024. And so in terms of all of the stresses and strains, and James, I was so sorry to hear your story. It doesn't seem like there is going to be a resolution. And as you said, the government don't want to call it a crisis, but health workers are certainly calling it the worst crisis in history, as are Labour. And it's not, at the moment, Anna, I'm afraid, there's no resolution in sight.
And just quickly, the first 2 and a bit rows here are those who work either at this hospital or the wider health community. If you could put your hands up, if you thought this was a crisis, what you've experienced so far in possibly the end of December and early January. So does 1, 2, 3, 4, 5 more of you putting your hands up? So now the audience starts to put your hand up. I will come to you, I promise, absolutely. Let's just speak now to Dr. He, who is Chief Registrar and speaks on behalf of junior doctors here. How's it been for you then and your team?
So there's been a huge increase in the numbers of patients outside of our usual medical spaces. And that's just a reflection on the amount of illness going around and us unable to get people out of the hospital. So yeah, it's been worse than usual, for sure.
OK. Dr. He, thank you very much indeed. Well, we've heard about the problems getting an ambulance, but even if you try to go yourself, it's often increasingly hard to be admitted to hospital. And that was certainly the case for Yusuf Mahmoud Nazir, and his uncle Zahir Ahmed is here in the audience with us. If you could put your hand up for me. Hi. Tell us about what happened with your nephew. I know we've spoken to you before on Sky News, and you told us then that he had severe tonsillitis. So what happened, and what did you try to do?
Yeah, Yusuf originally went in to the GPs with a sore throat. The GP diagnosed him with a tonsillitis. He then went, same day he got quite severe. He was taken to the hospital, waited approximately about 8-9 hours to be seen. He was told that from the hospital that there's only one doctor working on the night who's looking after the children, and also after midnight he looks after the adults. Yusuf was then seen by the doctor and was told it was one of the worst tonsillitis he's ever seen. He was then given antibiotics and sent home. We then fetched him back again a day later, and he was then given to the GPs, and he was then told that he needs to be on IV antibiotics urgently. His condition is quite severe with his tonsillitis. So we demanded the hospital to put him on IV. They said they've got no doctors available, no beds available, so they can't do anything. So they refused to put him on IV antibiotics. We then taken him to a different hospital. We had no choice, so we taken him to a different children's hospital. He was then put on IV antibiotics, but his infection spread to his chest. He spread it to his lungs, caused him pneumonia, and then Yusuf died.
And do you think he would have died if he'd had treatment? Do you firmly blame the lack of treatment for what happened?
It was definitely lack of treatment, because when Yusuf went to the other hospital, the Children's Hospital in Sheffield, Yusuf was given IV antibiotics as soon as he entered the A&E department. Yusuf, the day after, was sat up, he was playing his iPad, he was a little bit active, he was eating, he ate a little bit, and he had drank a little bit of water. So that IV antibiotic did work, but it was too late. The infection spread to his chest and his lungs, and then it caused him pneumonia, and then he just had organ failure from there. So it was, we believe as a family, and we do believe that if he was given the antibiotics when we was really begging him for the treatment, I was on the phone for 10 minutes and 43 seconds begging the ward to, can we fetch him, please, just to give him IV antibiotics. The GP said he urgently needs it, but the GP said, we're not allowed to refer anybody to the ward. We've been told we cannot refer any patients to the ward. We've got to send everybody to the A&E. So we do think that if he did get his antibiotics when he needed them, the IV antibiotics, Yusuf would have been alive today.
Well, the Hospital Trust has told us that an independent investigation is underway, but, you know, you heard the reaction of the audience. We all really feel for you and your family, and, you know, it's a very hard thing to deal with. You know, Hugh, you hear stories like that, you know, and very bravely told here in this audience. If there's one thing that could change right now to make things better, what would it be?
Well, look, unfortunately, the problems in the health system were long in the making, so they're going to be long in the fixing too, and politicians have to be honest about that. There's not a magic bullet, a single thing that's going to make a difference right now. Priorities, there's a couple of priorities probably in the short term. One is social care. I think expanding capacity outside of hospitals in social care in the community could help free up some space in hospital, but also give people the support they need. Part of that should involve improving pay for social care workers. Mostly women among the lowest paid workers in the UK experience shocking levels of poverty and deprivation. Doing that's going to require investment. The social care sector often gets small drips of money from government when actually it needs to turn on the tap to support that sector. But also ultimately, health and social care are a people business. We've got chronic staff shortages, we've got challenges with retention, with burnout. Over the longer run, government needs to put in place a strategy for recruiting, retaining enough staff in the future. Astonishingly, it still doesn't have one backed by funding, and that's what this system needs.
And Beth, that's exactly the point, isn't it, about recruitment and retention, and yet you've got striking staff. The difficulty is, of course, that health takes up an increasing proportion of the entire wealth of this country. And has it got to the point that some members of the Conservative Party, possibly, or others, are suggesting that enough is enough? And that's when you start to say, well, how else do we fund it?
Absolutely. And actually, when you look at health spending as a percentage of government day-to-day spending, it's now at about 44% of day-to-day spending. And it's set to rise to about 50%, just under 50% by the next general election, with the Conservatives putting, as you might have seen, an additional £6.6 billion over the next 2 years in the autumn statement. But demand is just outstripping supply. There is a growing discussion amongst politicians about it's time to have an honest conversation, as they would put it, about funding. I interviewed Sajid Javid, the former health secretary, at the end of last year, and he said we need to talk about how we are funding the NHS and have an honest conversation. Do we increase general taxation? Do we move to a hybrid model, such as in Germany or France, where you pay for some services or you have insurance? One former health minister said to me the other day that they think it is inevitable after the next general election, regardless who wins, that you might have to start charging for some services. That I can see people shaking their heads, because the principle of the NHS is free at the point of use. The issue, I think, Anna, is that politically for both parties, no one wants to have the conversation, because it involves hard choices about raising taxation. People want to win an election and they don't want to put that on the public. But the problem is, as you were saying, then the problem doesn't get solved. And it's the same with social care, which we can talk about a bit later on as well, in terms of how that's funded.
Yeah, absolutely. I know lots of people now want to get in. Perhaps we could speak to the lady in the pink shirt down here, actually. If you just wait 1 second while our microphone comes, and then, yes. Oh, yes, do continue, yeah.
I don't think that the turnover of health secretaries has helped us. So you were speaking there about Sajid Javid. Well, tonight I'm a pharmacist. I'm chair of the Royal Pharmaceutical Society in England, and we haven't heard about pharmacy this evening, but Sajid Javid understood that Pharmacy First, which is a scheme which would enable pharmacists to provide care which people shouldn't be seeing a GP for in the pharmacy on the high street, normally a 20-minute walk away from most people. But we've been waiting and waiting for that, and we really are hoping it will be coming soon. But we've seen the turnover of health secretaries hasn't helped us in that regard. One last point, if I just may. We've heard tonight about the cost of living crisis. Well, health inequalities have risen during the pandemic. And we know that our pharmacy teams are key to tackling that, helping people understand the importance of vaccinations, for example. But at this stage, with the number of pharmacies closing down due to underfunding, that's another pressure that's going to be on the rest of the health service. So we need a whole systems approach, which recognises as well that it's not just the doctors in general practice. We are all a team in primary care supporting secondary care, but we are tired as well, and it's relentless, the pressure that's on our teams. Thank you.
I wonder if we can take some more from the audience. The gentleman there in the suit, actually... Yes, you there. Yeah, thank you. Just wait 1 second till the microphone... Yeah, OK, yes.
Thank you very much. I'm a GP in Coventry. I've been working for the last 35 years. And I came from abroad. I've established myself as a GP. I know all the pressure NHS has, the way things are going on. I believe that NHS is in decline for the last 10 years and nothing has been done. I've got two sons who just recently qualified and they are working as junior doctors. My question is, what has any government done in the last 10 years to see that homegrown doctors, nurses, paramedics are going to work in this country, and why are they looking for importing doctors from abroad all the time? And then the question is, when the doctors are working or anybody's working, they're not paying them their salary properly and they're not treating them with respect. I'm quite scared. I believe a lot of children who qualify now will immigrate to Australia or Canada, because in this country there's so much of policing for the doctors. Anytime you raise a voice, they start using this clinical governance issue, and a lot of young doctors are scared to live in this country and they're planning to immigrate. And I'm very scared that my children also will be doing the same.
OK, and we know that the government has got a cap on the numbers it wants through training, which was relieved during the pandemic, but is now back. And in fact, they started insisting again, saying to the medical colleges that they would be fined if they don't actually stick to that cap. But that point being made there, that a lack of long-term plan has meant an over-reliance on foreign doctors and nurses in this country, Ed. Is that something that we've seen?
Yeah, and I mean, you know, there's in a sense, there's kind of two, well, I mean, there's many more than two. This is kind of, you know, a multipolar issue. But, you know, there's the staffing side, and then there's also the kind of investment in the facilities side. And these two things have been enormously underfunded in comparison with, you know, historical record going back recently. And in a sense, the more stark side is that facilities side. I mean, for instance, a couple of charts we can show you. First of all, looking at the number of hospital beds per 1,000 of the population. Well, the UK is way below where most other countries around the world are. I don't know if we can bring up that chart, but the UK is way above where most other countries around the world are when it comes to hospital beds per 1,000 of the population. Oh, there it is. So this again, looking around the developed world, there's the UK's bar, kind of way below most other countries around the world. Look at the number of CT scanners per million of the population. We're just way at the bottom for that as well. And talking to this question of just the investment in the facilities, you know, taking a step back, when you look at the amount of capital investment, so just the amount that the government is putting in, you can probably see a pattern here. That blue area is other countries, so other major countries around the world, and just how much as a percentage of GDP they're putting in, the governments are putting in, and it's been rising and rising and rising. And the red line is the UK, and you can see how the UK was tracking along with most other countries around the world. Then, not uncoincidentally, came 2010, and suddenly that line was just way out of whack with everywhere else around the world. Yeah. And, you know, there's many ways of looking at the impact of austerity, but this is a pretty stark chart.
But what's really interesting as well about this chart is if you ask Labour, if you win the next election, will you invest more money into the NHS? They will not commit to that. And I tried very hard with Angie Rayner in an interview recently to get her to commit to that. And what they will talk about, as you were talking about, is reform and reorganisation. And you say, yeah, I get, you can make the argument about using more pharmacies and changing provision of care and how you do it, but does it also need more funding? Most health experts would say yes. But a Labour government incoming, or a Labour government hoping, or a Labour Party hoping to be a government, they will not commit to more funding because they're worried that if they start to commit to that, then they get into a row with the Conservative parties. They're going to be careless with the nation's finances. You know how the record goes running up to a general election.
And because
and
the
so
nation
we're not
feels
having
broke,
the conversation.
Yeah, but the nation feels broke because of the series of shocks that have hit it, from the financial crisis, before 2010, Brexit as well, the pandemic, and now the Ukraine war. So it's a series of things that have squeezed the economy, isn't it? Lots of what we've talked about has been acute care. There's chronic issues too, and ongoing care too, that hospitals have to manage. Some areas just have to keep on running. Well, Sky's health correspondent, Ashish Joshi, is joining us now from the dialysis unit. And this is part of, the nuts and bolts of hospitals, quite aside from whatever crises, that just have to keep functioning, Ashish.
That's right. They're offering life-changing, life-saving care in this renal unit. Up to 10,000 patients, kidney patients, are looked after here. It's one of the busiest in the country. 200 patients come here every day for their dialysis, and you need to keep services like this going through a pandemic, and that presents challenges not just during a health crisis like the pandemic, but the health crisis the NHS is facing now. And all of these patients who come here, Anna, need expert nurses and expert doctors. And I'm glad to say that we're going to talk to matron Linda Mott and Dr. Krishna Uppanu, who are from this dialysis unit, this renal unit. Let me ask you first, Linda Mott, we've been hearing from our studio panel and the audience about the pressures on hospitals. How do you protect a service like this one from the pressures that the rest of the hospital is facing? Or are you not immune to it? Do you feel the same pressures here?
Yeah, we absolutely feel the same pressures. There's been a certain increase in the demand on beds this year, and that's been felt from the front door up to our wards and into the outpatient departments as well. Coupled with the fact that we've had staff sickness as well has made life quite difficult for us here at UHCW. However, I think we do what we do best, and that's put our patients first. And we continue to deliver a really high quality service. And we're very proud of the team that we have here at UHCW.
Yeah, there are pressures which flu and COVID bring, pandemics, but also now you're gearing up towards having this service remaining through industrial action. You haven't been affected by the nurses' strike at this trust, but the ambulance workers going out, that will put pressure on you and the services you provide here.
Yeah, absolutely. We've had, I think, 2 days of ambulance strikes here already and a day of physio strikes, which has happened today. And I think we just look to forward plan everything. We put contingency plans in place so that patients receive the care that they really need.
Okay, good. Thank you, Linda. Krishna, let me talk to you about kidney failure, chronic kidney disease. Is your demand rising from patients for your services?
There's been an incredible demand rise in patients presenting late, and there's been an incredible demand for the service as well. But as a team, we've managed to put contingency plans. We've created more hot clinics and more spaces to see these patients. Because of the pandemic, patients have been presenting a bit late. So we've been trying to put in alert systems to see if we can recognize early and prevent them progressing to chronic kidney disease, actually.
Okay, we've been talking about the future of the NHS. Elderly patients, are you geared up towards looking after an ageing population?
The pandemic has certainly taught us lessons. We have faced a lot of adversities. We facilitate about 200 dialysis sessions a day, as you said, and we were thrown into situations where we had to barrier these patients and also prevent the infection spreading from one patient to the other. And that has taught us a lot of lessons, and credit to my incredible team that we've come out stronger and we're prepared for the future.
Hard lessons you'll carry into the future. Krishna, Linda, thank you very much. 2 frontline doctors and nurses working in chronic kidney control here at the renal unit, and they just have to keep working through pandemics, through a health crisis, and through the industrial action that's coming next.
Ashish, thank you very much indeed. Well, even leaving hospital can be problematic too, especially if it is to go to some other care setting, as we've heard about, the sort of blockages in the system. That was certainly the experience of Sarah Templeton, another member of our audience. We heard about infection control. And Sarah, I think your experience combines both of those. Tell us what happened.
Well, it was horrendous. Excuse me. My mum went into hospital on the 11th of November. She had Parkinson's, but it was very, very well managed, and there was no problem with Parkinson's. She used to fall over a lot. It was very common. She'd fall over 3 or 4 times a day. But this one time she fell over, she did a bit more damage than normal, and the doctor was worried, so he sent her to hospital because he thought she'd had a stroke. She actually hadn't had a stroke. She'd punctured a lung, and that was why she couldn't breathe and couldn't talk. So she went into hospital she actually had 6 fractured ribs, a punctured lung and a damaged spleen. She ended up staying in there 7 weeks. During that 7 weeks, we were told at one point she had COVID. So she was moved. I do stress we'd kept her COVID-free all the way through COVID, and we'd kept her flu-free as well. We'd done everything that the government told us to do. But in the hospital, we were told she'd got COVID. She was moved ward. We all had to wear masks. Then 3 days later, I said to her doctor, how's my mum doing with the COVID? Is she over it? And he looked up, he went, your mother's never had COVID. Put the thing down. So we were like, seriously? OK. Anyway, we're now 4 weeks in. They say, your mother is medically fit. Medically fit, apart from the Parkinson's, which is managed, and she can be moved to a discharge and assessment centre. So we're like, fantastic. But it didn't happen. She sat. She was bored, stupid. She wanted to move. And then she got a chest infection. And then she got the flu. And then she got pneumonia. And then we sat holding her hand while she died on December the 30th. And she didn't need to die. My mum didn't need to die. My mum was perfectly well. She was perfectly well for 3 weeks. She was bored. She wanted to come out of that hospital. And 2 doctors, I cannot fault the doctors and the nurses. They were all amazing, all of them. But 2 doctors told me on 2 separate occasions, I'm really sorry, Sarah, but this is what happens when you come into hospital now. If you come in and you're elderly or you've got lower immune system for whatever reason, you will get a chest infection, you will get the flu, you will get pneumonia, and you will die. And I said to both of them, why didn't you tell us that? Because we would have broken her out of here. We would not have left her here. We thought she was in the best place for 7 weeks. We went in every day for 7 weeks and held her hand. And then I had to sit and watch her with masks on her face, gasping for breath. And she died gasping for breath. And that's how she died, because there was nowhere to take her. And they wouldn't let us take her home because she was under a Section 42, had to be the responsibility of the local authority. But the local authority didn't look after her. So she ended up staying and dying for no reason.
I'm so sorry to hear that. You heard the gasps again from the audience here, didn't you? We're so sorry to hear that. And just that didn't happen in this area, just to point out. But for all of you in the audience, would you feel confident in having an older relative go to hospital right now? If you could put your hands up for yes, you would. Yes, you would be confident. So the medical staff would at the front here, and one member of the audience there. Yes, you want to come in. You've been trying all programme, yes.
I'll keep this very short. The question asks, can the NHS survive Phil Brown South Shields? I hope that it does. My life was saved at 7 weeks of age with a cerebral hemorrhage, 4 weeks of age with a cerebral hemorrhage, and I was fortunate enough to nurse for 44 years and represent sick children's interests for the whole of the United Kingdom. Give a kid a chance. This is what the NHS can do. The Bevanite part of me, my dad was a coal miner. And he said, and if I don't get it right, I'll try and paraphrase it, the NHS will survive for as long as there are people, even now, who are prepared to fight for it. And then... And just to end, because I'm not privileged in nursing, I have been moved by the people who have given their testimony. Think tank, I'm like Rust, I never sleep. Give us back an elected nurses' council. Take away the parking charges. Give us a 4-day week. We will graft. 3 days. 3 days refectory time. Have a nurse bank, not an agency. Get the money back. And watch what all NHS staff can do. But I accept we are on our chin straps. Thank you so much.
OK. And just quickly, yes, the man with the bobble hat. Sorry to describe it, yeah.
Hi there, I'm a student and I'm looking to start my adult nursing degree in September this year. And I, alongside a lot of my colleagues that I've worked with and also other students, are really worried about the future of the NHS, and we are the future of nursing. We choose and we are passionate to do that. However, there is so many aspects, and there's so many things in the public sector and social sector that really worry us. And for the current staff in the NHS and the public sector, I commend you. We all commend you as the youth and the young people of the country. And my question is, what is going to be put in place through our government and with the NHS to attract people to be a nurse? And also, when they're attracted into the profession, how are you going to keep them? How are you going to keep them? Because so many people are leaving, and I, as well as my colleagues, see so many things, so many people leaving the NHS to go into private sectors, and it's scary, it's dangerous.
Well, thank you for both of you for your contributions. We'll come to more of you, I promise. Hugh, just on the point of older care that we talked about there, we know that half the people over 65, and we learnt this during COVID, have 2 or more comorbidities, and 2/3 of those people are the ones who end up in inpatients in hospital. You know, that is a critical part of this conversation, is our demographics, isn't it?
Yeah, and it's also a success. It's good that people are living longer.
Yes.
It's a success of modern medicine, but they're also growing older with more complex conditions, and the question is, how do you look after those people and help them to live a healthy life? This is not just a challenge for the NHS, it's countries across the world that need to do that. This brings us back to social care and one of the gaping holes in our welfare state. We've got a social care system that looks after older disabled people of all ages, but also older folks too. And at the moment, it's a threadbare safety net. It's only available state-funded care for people with the highest needs, the lowest means. Many people go without the care they need. Some people face very high costs. We've had successive governments that have promised to reform the system, and then successive governments that have delayed and then ditched reform. This government's no different. Basically means politicians are choosing to prolong a major public policy failure that means many older and disabled people are not getting the support they need. So the health system has to work out how it manages care for people with complex needs. That's better integration of services between GPs and hospitals. That's more investment in prevention, early intervention to keep people well at home. But it also needs political will to actually fundamentally reform our social care system to make it fit for the future.
OK. Now then, of course, health problems can go on for a long time. That's not only for older people too. Many younger people have long-term conditions that need looking after. In the case of Paul and Michael Atwell-Bryce, that care is for their sons, Levy and Lucas. And I don't know which of you would prefer to speak. Michael, perhaps. But you adopted twins, did you not, that have a range of problems. And for you, it's been a struggle to pull the care you need out of the system.
Yeah, so we feel like we've had to beg for everything from the boys from like 2-year-old. So at 3-year-old, they were diagnosed with severe autism. And then they both started with seizures, one after another. So they're both severely epileptic as well. So just for the care for the boys, we've had to fight for, like, over Christmas we were left with no syringes because we feed them medical, like, fibre drinks through a syringe. We were left with no syringes because they've passed them to adult services, now they're 16. When they needed support from CAMS, Levi only got that last year for his mental health, and that's at age 16. We referred him 10 years prior to that, so we waited 10 years to have support from CAMS.
But then you always say about early intervention, and here we are, families like ourselves in the UK that are fighting for the correct support for these children, and it's physically not there. Identical twin boys, both with the same difficulties, one that can get the cannabis treatment for his epilepsy, the other can't. Levi can get it because he's been ventilated, but Lucas can't because he's not seen as serious enough. And it all comes down to money and costing all the time. And there are so many families out there in the UK that are in our situation, that are caring full time for such children with complex needs, and the support and help is not there, and they're having to fight constantly. And some parents haven't got that fight within them, let alone dealing with the child themselves.
So we deal with a lot of charities, and things are getting passed to charities to fundraise to diagnose children with autism. Why can't our NHS do that? Why is it getting passed to charities and to have to fundraise for that? Why do we have to fight for cannabis treatment when their epilepsy is so severe? Levi's on 6 different epileptic drugs. He's been on life support machine before. We've nearly lost him. And we have to say we thank the doctors and nurses for all you do, but the money's not there. We're getting passed from pillar to post. There's people at social care saying we don't fund this, try social care. They're passing you from pillar to post to get the equipment, support, the medications. Like they've been on wheelchair waiting lists for over 6 months for a new chair. We can't physically carry them now if they have a seizure. They're nearly 17.
But you're having to manage the children themselves, and it's so complex. And a lot of doctors listening to this in paediatric will understand that. It's so complex, and it can be a case of life and death. And if we don't sort it out, who's going to look after these children? Because in the end, they'll have to go into specialised provisions that will cost thousands of pounds, yet at home we're keeping them in a family environment.
You're doing an extraordinary job, and you know we all wish it was easier for you. And that goes back to what exactly? I mean, Beth, where are we now? You know, Sir Keir Starmer has said that the NHS is no longer an out-of-bounds shrine. We've had a former Health Secretary, Sajid Javid, talking about a voluntary contribution, £20, he said, for a GP. Does it feel like politicians are edging towards reform of the health service?
I think that what will happen is that this will all be put on ice until after the next general election, which will probably happen in about 18 months' time. And as you were just talking about when it comes to social care, Boris Johnson did have a plan for social care. It did involve a tax rise. It would have raised £12 billion a year. That would have been front-loaded to the NHS and then moved into social care, and the policy got scrapped. One thing I would say is positive about all of this tonight, and I did an interview this week with Justin Welby, the Archbishop of Canterbury, because the Church of England has done a commission on reimagining social care in which they talk about having an NHS-style universal provision, is that the crisis that the NHS is in and the love that people have for it, and you can see it in the audience here, is that it is provoking a national conversation about how do we reform the NHS, what do politicians need to do. So I think the discussion is being had, but I have to say the hard politics of it are these are very difficult political issues. They become politicised, and it means it's very difficult for politicians to do anything that isn't short-term with an eye on winning a general election and then maybe having the conversation afterwards.
We're running out of time. I do apologise. Let's go back to your Bevan quote, shall we? It'll survive if there's enough people to fight for it. Are there enough people to fight for it, Hugh?
Of course, and the public has really strong support for the core principles of the NHS. It's free at the point of use, available to all, predominantly tax-funded. A lot of this political rhetoric about radical reform of the NHS is a distraction. We talked about the problems in the NHS today. They're plain to see. A decade of underinvestment, neglect of social care, not enough staff. The solutions are mostly unglamorous, pretty well known. More staff, more investment, better integration of services, things we've been talking about, more capital investment, more equipment. The NHS has done this before in the 90s, long waiting times. A government invests in the health system, it boosts staff, performance improves. A lot of the ideas are not based on evidence. Switching to a social insurance model, it's going to be a massive waste of time and money. No evidence would say it would lead to better outcomes, and the public don't want it. The politicians should focus on the real problems facing the NHS, staff shortages, low investment, and think about what they need to do about it and be honest with the public. That's going to take time and it's going to take investment, but of course it's worth doing. Listen to the audience today.
Yeah. So are you saying, yes, the NHS can survive and in its present form? Yes.
The model of the NHS is not the issue here. It's how politicians have treated the NHS.
Well, a final thought from Ed, and I don't want to end on a downer. Is it unaffordable? I'm sorry to say. We talked about living longer, the expense of medicines, all the new technology that's coming through. Can our nation afford it?
Well, I mean, yeah, we can absolutely afford it. And, you know, what it needs is a case of politicians thinking in the long term. And part of the issue, and it's not just health, but part of the issue with this, with climate change and what we do with the energy transition, with what we're doing with the kind of state of the benefit system in the UK, is that for a long time, you know, we haven't had politicians who are willing to look beyond the next few years. You know, the state of our transport system as well. And so were we to get kind of, to have politicians who did want to think in the longer run. There are plenty of things that could be done, and you mentioned some of them. Hopefully, over the course of the next year, we'll be looking at many of those kind of opportunities. There are opportunities. There are enormous challenges, and it's heart-wrenching. I cover data, and behind every chart that I show, I know there are heart-wrenching stories, and we've heard some of them tonight. And unfortunately, the proportion of those stories has gone up. It needs a systemic look at this. We're going to start doing that at Sky News, and politicians who are willing to look beyond the next few years. Unfortunately, we don't have many of them at the moment.
Well, let's ask our audience. I know you've all got your hands up, and I apologise we can't get to everybody, but just on that point of whether you'd be willing to pay more. We're not talking about privatisation here, but the idea of a small personal extra contribution to keep it. Would you put your hands up for yes? OK, that's yes. And then our substantive question of the night. Can the NHS survive in its present form? Yes for up. That's nearly all of you, I have to say. That's nearly all, which they will be heartened to hear in the 75th year of the NHS, which comes up this July. Thank you so much for your contribution. That's it for now. But do remember, it is only the start of a project that will last all year. We've had the initial consultation about the state of the NHS, and over the coming months, with analysis from the Health Foundation and from the King's Fund, we'll diagnose what's making the NHS struggle and work out how to treat it, if it is to survive, as you want it to, I think. My thanks to our panel this evening, Hugh Alderwick, Beth Rigby and Ed Conway. Thank you too to Coventry and Warwickshire hospitals and all the staff here tonight who have been so very helpful over the 2 days we've been here. We're very grateful. Thank you very much indeed. Yeah, they deserve a clap. Thank you. And in particular, I did want to thank those members of our audience who've been sharing their stories about the state of the NHS. It's not easy for you, we understand that. Thank you also for watching. A very good night from all of us here. And don't forget, a year-long project. Stay tuned for Sky News. Plenty more to come.